Welcome to the Education Department's Playground Safety Training, presented by Dr. Melania Kesselglou, the Director of Education, and a National Playground Safety Inspector. The rationale for today's training is this. Gross motor play is the key to a child's development. Therefore, it's important to understand how we can guide the development of these skills safely. Our training will focus on the playground requirements that we must adhere to create a safe environment for outdoor play. Remember, safety is everyone's concern. The Head Start program performance standards that apply to today's training are as follows. 1302.47 Safety Practices. A program must establish, train staff on, implement, and enforce a system of health and safety practices that ensure children are kept safe at all times. B. A program must develop and implement a system of management, including ongoing training, oversight, correction, and continuous improvement in accordance with 1302.102 that includes policies and practices that ensure all facilities, equipment, and materials, background checks, safety training, safety and hygiene practices, and administrative safety procedures are adequate to ensure child safety. 1303.52 Insurance, Bonding, and Maintenance. C. Maintenance. A grantee must keep all facilities purchased or constructed in whole or in part with Head Start funds in good repair in accordance with all applicable federal, state, and local laws, rules, and regulations, including Head Start requirements, zoning requirements, building codes, health and safety regulations, and child care licensing standards. Now let's hear from the Early Childhood Learning and Knowledge Center. This video was taken from a training titled Playgrounds, Promote Safe and Fun Outdoor Play in Head Start and Child Care.
The national data tells us, and we can determine the most common injuries among young children. And here we see that falls are the #1 cause of unintentional injuries, so good job. You can also see that fire and burns, poisoning, motor vehicle incidents, and suffocation are also among the major causes of injuries to young children. Young children can get hurt anywhere, but what this data tells you about where children are likely to get hurt in Head Start and child care programs is on the playground, although falls can and do happen anywhere. Over 200,000 playground-related injuries are treated in an emergency room each year, and most of these injuries occur at schools or child care centers. Data from playground injury visits to the emergency department show that injuries are most common in September, April, and May. Knowing when injuries are more likely to occur should inform a program's injury prevention strategy, especially as injuries are most likely to occur at the start of the school year and in the spring when kids may be reorienting themselves to the play equipment after they've been away for the summer or have been inside more often during the winter. We also know from national data that falls from, into, or on equipment are the most common cause of injury. Falls are most likely to occur on equipment that is not appropriate for the age and development of the children, and injuries are most likely to occur when the surface onto which a child falls is not sufficiently shock absorbing. The equipment pieces that are associated with the most injuries include climbers, such as monkey bars or overhead ladders, swings, and slides. About 85% of all playground injuries occur on these three pieces of equipment. And a few of you who selected strangulation as the most common cause of injury were on to something. The most common cause of death is strangulation, and that's an injury that chokes a child. This occurs most commonly on slides or swings and involves ropes, dog leashes, or drawstrings that get tangled around a child's neck. Clothing with drawstrings, necklaces, and bicycle helmets should not be worn on playground equipment, and equipment should be inspected for entanglement hazards such as protruding bolts that can snag clothing or hooks that can catch drawstrings, and playgrounds should always be checked for any children remaining outside unsupervised.
As a consultant, it's important to understand that injuries are not accidents. Most injuries are predictable and preventable.
As we just learned, playground accidents are predictable. Our first line of defense to prevent injury is active supervision. Children First procedures state, staff must interact with children while outdoors and supervised by sight and sound at all times. The transition tracking form must be completed daily according to agency procedural guidance. Head count should still be taken every 10 minutes while on the playground. Staff must follow zone defense while on the playground and not gather in groups or sit. When transitions occur with a group of children, for example, exiting the classroom, one teacher must be at the head of the line, the other at the end. Each teaching team must develop a system to ensure communication and continuous safety of the group. Teachers must communicate with one another through any and all transitions, as well as complete the transition tracking form accordingly. Ratios must be maintained. For example, staff bathroom use, staff breaks, etc. When using public playgrounds, staff must complete a safety audit, ensure equipment is age appropriate, and review safety rules with the children prior to releasing them to play. Zone defense must also be incorporated and discussed amongst staff prior to releasing children to play. The U.S. Consumer Product Safety Commission is an independent federal regulatory agency with a public health and safety mission to protect the public from unreasonable risk of injury and death from consumer products. The Commission's Public Playground Safety Handbook was first published in 1981 under the name A Handbook for Public Playground Safety. The recommendations in the handbook are focused on playground-related injuries and mechanical mechanisms of injury. Falls from playground equipment have remained the largest single hazard pattern associated with playground use. Public playground equipment refers to equipment for use by children ages 6 months through 12 years. This handbook is intended for the use by child care personnel, school officials, park and recreation personnel, equipment purchasers and installers, playground designers, and any other members of the general public concerned with public playground safety and interest in evaluating their respective playgrounds. Today, we're going to discuss several areas associated with playground safety. There are two options available for surfacing public playgrounds: unitary and loose fill materials. A playground should never be installed without protective surfacing of some type. Concrete, asphalt, and other hard surfaces should never be directly under playground equipment. Grass and dirt are not considered protective surfacing because wear and environmental factors can reduce their shock-absorbing effectiveness. Carpeting and mats are also not appropriate unless they are tested to and comply with ASTM F1292. Loose fill should be avoided for playgrounds intended for toddlers. Unitary materials are generally rubber mats and tiles, or a combination of energy-absorbing materials held in place by a binder that may be poured in place at playground sites and then cured to form a unitary shock-absorbing surface. Unitary materials are available from a number of different manufacturers, many of whom have a range of materials with differentiating shock-absorbing properties. Loose fill materials are generally landscaping-type materials that can be layered to a certain depth and resist compacting. Some examples include wood mulch, wood chips, sand, pea gravel, and shredded or recycled rubber mulch. This table illustrates minimum compressed loose fill surfacing depths. 6 inches of recycled rubber protects a fall from 10 feet. A minimum of 9 inches of sand protects a fall from 4 feet. A minimum of 9 inches of pea gravel protects a fall from 5 feet. A minimum of 9 inches of wood mulch can protect a fall from 7 feet. A minimum of 9 inches of wood chips can protect a fall of 10 feet. In order to maintain appropriate fall zones, staff must remember to rake under ladders, slides, swings after each classroom's use. Now let's discuss playground hazards. Entanglement and impalement. Projections on playground equipment should not be able to entangle children's clothing, nor should they be large enough to impale. Drawstrings on the hood of jackets, sweatshirts, and other upper body clothing can become entangled in playground equipment and cause death by strangulation. To avoid this risk, children should not wear jewelry, jackets, or sweatshirts with drawstring hoods or other upper body clothing with drawstrings. Remove any ropes or similar objects that have been attached to playground equipment. Children can become entangled in them and strangled to death. Head entrapment. Head entrapment is a serious concern on playgrounds, since it could lead to strangulation and death. A child's head may become entrapped if a child enters an opening either feet first or head first. Head entrapment by head first entry generally occurs when a child places their head through an opening in one orientation, turns their head to a different orientation, then are unable to get themselves out. Head entrapment by feet first entry involves children who generally sit or lie down and slide their feet into an opening that is large enough to permit their bodies to go through, but is not large enough to permit their heads to go through. A part or a group of parts should not form openings that could entrap a child's head. Also, children should not wear bicycle helmets while on playground equipment. There have been recent head entrapment incidents in which a child wearing a bicycle helmet became entrapped in spaces that would not normally be considered head entrapment. Certain openings could present an entrapment hazard if the distance between an interior posing surface is greater than 3.5 inches and less than 9 inches. Additional playground hazards such as sharp points, corners, or edges on any part of the playground or playground equipment may cut or puncture a child's skin. Sharp edges can cause serious lacerations if protective measures are not taken. In order to avoid the risk of injury from sharp points, corners, and edges, we must ensure that exposed ends of all tubing not resting on the ground or otherwise covered should be covered by caps or plugs that cannot be removed without the use of tools. Wood parts should be smooth and free of splinters. All corners, metal, and wood should be rounded. All metal edges should be rolled or have rounded capping. Play areas should be free of tripping hazards, such as sudden changes in elevation. Two common causes of tripping are anchoring devices for playground equipment and containment walls for loose fill surfacing materials. Bike paths must be clearly marked. Children playing nearby must stay clear of children riding tricycles, bikes, and/or scooters. All children riding bikes, tricycles, and scooters must wear helmets and stay on the identified bike path. Sheds located on the playground must be closed and locked so children cannot play inside. At the end of the day, playground equipment and riding toys must be stored for the night. A nightly sweep of the playground must be conducted to ensure that all equipment and toys are put away. Each center should identify a playground safety inspector. The playground safety inspector must conduct daily morning playground inspections prior to any play on the playground. You will find here a copy of Children First Playground Safety Checklist. This checklist helps the playground safety inspector evaluate if the playground is safe for daily play. The inspector will check if the playground equipment is safe and sanitary and in good repair. Is the equipment safely anchored? Are all supports, connectors, and moving parts secure? All equipment, fences, and playground objects are free of sharp, broken, or jagged edges. Equipment allows for proper drainage, and there is no standing water on the playground. The fence is continuous in structure with no gaps between the ground and the bottom of the fence. The gates are in good working order and latches work properly. The protective surface under the equipment provides proper resilience to prevent injury. Playground is free of litter, nails, glass, or other hazards such as insects, nests, wasps, and fire ants. The bicycle paths and walkways are clear of debris. The indoor and outdoor environments are free of mold and pollutants, including smoke, lead, pesticides, and herbicides, as well as soil and water pollutants. Sand and water play are designed for individual play. The area is clean and sanitized after each use. All play areas are visible by adults. There are no blind spots. Playground capacity signs are posted. Fall zones under swings and slides are maintained. Loose ground covering is raked back into place after each use. High-touch areas are disinfected after each use. Bicycles and helmets are disinfected after each use. When individual helmets are not available, children wear bonnets under the helmets. Playground toys are cleaned and disinfected before each use. Hand sanitizing stations are available for use. The solution is filled. Cleaning and disinfecting solutions, gloves, and paper towels are available for staff to use while on the playground. Cleaning and disinfecting solutions are kept in a locked cabinet or storage area. The trash cans are emptied each day. Trash can lids are cleaned and disinfected each day. The playground safety inspector then initials off on this checklist. The checklist is now kept in the Education Department's SharePoint under the 2021-2022 education forms. Thank you for participating in today's training. The health and safety of our children in our care is our primary focus. We all need to do our part. Please remember to report any safety issues and/or concerns to your supervisor.